What if I told you that poor vision may actually increase your risk of dementia? And a simple eye exam or cataract surgery could help protect your memory, your thinking, your mobility, and even reduce your risk of falls. But the most surprising part, up to 19% of dementia cases may be related to vision problems we can actually treat. Let me explain. In this video, I'm going to break down the latest research and what it says about how your eyes and brain are connected, how cataract surgery affects dementia risk, and what steps you could take today to protect both your vision and your long-term brain health. My name is Dr. Marc Shomer. I'm a board-certified ophthalmologist. I have a PhD in neurology from UCLA, and I'm a clinical instructor of ophthalmology at the Doheny Eye Institute at USC. The eyes are an integral part of the brain, so it's not surprising that the latest medical research shows that untreated vision problems as a modifiable risk factor for dementia, meaning it's something we can fix. An expanding body of evidence shows that treating vision problems such as cataracts can improve cognitive scores, it may even lower the risk of developing dementia, and it can lower the risk of falls and hip fracture. Recent studies estimate that treatable vision problems may account for roughly 5 to 19% of dementia cases. So let's look at the studies which show an association between vision loss and dementia. In a large population-based study which looked at roughly 500,000 40 to 69-year-olds, they found that people with vision impairment have higher rates of later life cognitive decline and dementia. A meta-analysis, which is a study of multiple studies grouped together, found roughly a 40 to 50% higher risk of dementia in those with vision impairment. As a result of these types of studies, the Lancet Commission explicitly added poor eyesight to its list of modifiable risk factors for dementia. What happens to the brain after cataract surgery? It turns out there is a lower dementia risk after cataract extraction. One of the most informative studies comes from the Adult Changes in Thought study. They looked at older adults who had had cataract surgery and found a 29% lower risk of developing dementia compared with similar groups of people who did not have the surgery. Multiple studies have looked at measures of mental status before and after cataract surgery and have found significantly improved cognitive ability before and after cataract surgery. In addition, neuroimaging studies have also been used before and after cataract surgery. They looked at functional magnetic resonance imaging and found that by 6 months after surgery, there was an increased pattern of brain activity similar to healthy control subjects. Gray matter volume was significantly increased in a broad network of visual and cognitive areas. Also, second eye cataract surgery was associated with even more of a benefit. After cataract surgery on both eyes, improved cognition normalized brain function and activity, and increased gray matter volumes in visual and higher order cognitive areas. So visual restoration after cataract surgery promotes functional and structural brain recovery. What happens to other things like risk of falls and fracture? Well, this is another big win for better vision. Poor vision is a major risk factor for falls and injuries. A meta-analysis concluded that at least one-eye cataract surgery lowers the frequency of falls in older adults. And second eye surgery additionally shows a further reduction in falls and hip fractures. Sang and Coleman and colleagues in 2012 found a 16% lower odds of hip fracture within 1 year of cataract surgery compared to similar patients who did not have surgery. The protective association was even stronger in older individuals. How might fixing vision help the brain? Well, more brain stimulation gives a cleaner, sharper input to the brain and keeps visual attention and networks engaged. Also, more movement, more social contact, people can get out more, exercise more, encouraging other behaviors which are known to protect cognition. Also, cataracts block a lot of the blue light coming to the eyes, and actually restoring this may help promote normal circadian rhythms, night-day cycling, which may help improve memory and sleep. What does this mean for you protecting your brain and protecting your eyes? Well, it's important to get regular eye exams, wear updated glasses or contacts, treat eye disease early. The benefits go beyond just seeing better. Don't postpone cataract surgery if it's affecting your daily life. Surgery is highly effective, and the best evidence suggests it can improve cognitive scores, and there's a lower risk of dementia. Expect safer mobility after surgery and decreased risk of falls and hip fracture. 2-eye surgery is better than 1. Second eye surgery brings extra gains in depth perception, contrast, and stability. Don't ignore blurry vision. Vision loss is not an inevitable part of growing old and something just to live with. It's now recognized as a modifiable dementia risk factor. The bottom line is, while randomized trials are limited, the totality of the evidence seems to suggest that cataract surgery is associated with better cognitive scores in the short term and lower dementia risk over years, especially when both eyes are treated and vision is meaningfully improved. The data so far is association, so true causation cannot be established. So it's all about improving your brain health for the long term. And that's one thing that's very important. You have a conversation with your eye doctor about what's best for you overall. It may not be cataract surgery. Maybe you just need a new pair of glasses, or maybe you need some lubricating drops. Your eyes are more than just a window to your world. They're a window to your brain. Taking care of your vision today may protect your memory tomorrow. Thanks for watching. I hope you gained some value from this video. Please leave a comment down below. If there's specific questions you have for me, I'm happy to answer it. Also, if you could please give a shout out where you're listening from, that would be very helpful. Make sure to subscribe for more videos on protecting your vision to make sure you're making the best decisions for your health.